Yes, it's time for our Doctor on the Line segment, and we have returning, of course, Dr. Adrian Lord. Good morning, Doc.
We have returning Colin Cunningham.
Indeed.
Returning. I haven't seen you for a little while.
Yes, I have been doing a little bit of traveling, getting around. I suppose, too, at this time, I should start thinking about, getting in shape for wearing, nothing.
Little.
Oh, little.
No, nothing is not.
On Kadooman Day.
Nothing is not acceptable.
It's not?
But, some people go skimpy, but we need to be decent.
Oh, okay.
In my band...
I was saying sometimes even the people who are wearing skimpy, that looks a little indecent to me. But that's a different story. But it's at this time of the year, though, or probably maybe a month ago, well, about now, people start thinking, you know what, I need to fit into that costume. Let me get into a program. How healthy is that? They're
a little late, but it's better late than never. In my band, I jump with Gwyneth Squires every year, and this year we're bringing a band called Islands of Treasures, which is going to be another winning band,
Of course.
Yeah, hello, Gwyneth. But yeah, you need to start, you should have been exercising for good health and not exercise for crop over. But people use crop over as a guideline, and the gyms are very busy, the highways are busy, everybody trying to get
It's not totally bad, though, because I know you should be doing it on a regular basis, but is it totally bad to have events that you sort of build your fitness around?
It is not bad. We have to have targets sometimes. We get the house ready for Christmas.
Right.
And we could have done it all year. We get our bodies ready for crop over or for that wedding or for that whatever show or whatever.
And then come Christmas, we let it go.
So it's better than nothing. And once you do it for crop over, then you could continue doing it. When I first jumped from the stadium to Spring Garden, now we go from Warrens, I said, well, if I can do that, I can do it all year round, and then you don't do it again until the next year. But, you need to watch your diet, eat healthy, cut out the greasy foods and fried foods and the sweet drinks and the macaroni pies and that type of thing, and increase your physical activity. You should be walking, running, jogging, or in the gym doing a particular program to strengthen those muscles to get you ready for Kadooman Day, if that is what you're going to be doing, because there are a lot of other crop over events.
We have a call on the line, so let's go straight to the phone lines and say good morning to Gail.
A blessed and a wonderful morning to everyone.
And to
I'd like to know, I'd like to ask the doctor these questions. I want to know people who suffer of hypertension, then develop diabetes, and after develop kidney failure. Is it the medication? And you could give me an answer, please.
Right. Kidney failure or kidney disease is a common problem in Barbados, and because of the high incidence of diabetes and hypertension, it is not the medication that will cause the kidneys to go. It is the condition, especially if it is not well managed. Many times when diabetes is diagnosed, you would have had diabetes for 5 years before that time, before that blood sugar or urine sugar shows up. So there was damage being done there. So when diabetes is diagnosed, you need to keep it under accurate and tight control all the time to prevent progression of that kidney disease or heart disease or vascular disease of blood vessels. Similarly, high blood pressure, if it is too much pressure, put pressure on the kidneys, can damage the kidneys. Therefore, these things can complicate them. Of course, when you're taking medication and the disease occurs, you think it's the medication, but the disease is because of inadequate control that may cause the kidney disease, which are complications occurring.
All right, and we also have Dorothy standing by. Good morning, Dorothy.
Good morning.
How are you this morning?
I'm fine.
All right, speak to the doc.
Doc?
Morning.
I have, on mornings I get up, I have a lot of numbness in my left hand, and then it goes down my feet. Could you tell me what is that?
It is difficult to say offhand, but usually that could be due to a nerve being, as Bajans would say, being pinched. You sound like someone who may have arthritis in either the neck or back or both, and that numbness is because of the position of your neck and the muscles tighten up and the arthritis pinching the nerve, so to speak, when you wake. As you go on and move around, the spasm in the muscles may be reduced, you become more loose, and therefore that numbness may go away during the day.
All right, thank you, Dorothy, for calling up. We were speaking a little bit earlier about the liver. Is there specific things that we can do for certain organs in the body to ensure that they remain healthy? Like, you know, like I know drinking a lot of water is one thing that will perhaps help the liver. What are certain practices that we can do?
Yeah, drinking a lot of water helps with kidney.
Kidney, sorry.
Yeah. Right.
I didn't go to medical school.
Right. Similar area.
Right.
As far as the liver, you need to, don't put too much pressure on the liver by eating healthy. Too much alcohol fight for other things that the liver would do and can cause the liver to fail or to break down. The liver, however, is a large organ and has a lot of reserve, and therefore it can withstand a lot of damage before
we shouldn't test it.
Yeah.
All right, we have Pat on the line. Good morning, Pat.
Hi, good morning to you and also to the doctor.
Good morning.
My question is, I'm anemic, really anemic, and I've been to the doctor recently, and he told me my blood count was like 8.6, which is really, really low. What I want to know is, what's the best, he's putting me on Trihemet, but what I want to know is, what's the best thing to bring up my blood count? Just the fact that I am also due surgery and I want to donate my own blood. I don't want to get blood from someone. I want to do my own blood donation. What I want to know is, what's the best thing to bring up my blood count? I've been like this since I was a teenager.
Yeah.
But the simple fact is, I'm sorry, that I don't eat red meat.
Yeah, okay. Well, the medication your doctor has put you on should help to bring that blood count up to a reasonable level to get it ready for surgery. But being anemic, and it seems that you have an iron deficiency anemia, you are losing more blood than you're taking in. More iron than you're taking in, and you don't eat red meat. It could be because of heavy bleeding. It may be because you may have fibroids and heavy bleeding. You say you're due for an operation, and the doctors are not going to risk doing an operation except in an emergency situation with a blood count of 8. You need to get it up to at least 12. So in a couple of months, if you use the medication that the doctor has you on, eat spinach is also good. Vitamin C helps with iron absorption as well. You can get that hemoglobin to a reasonable level to allow you to have that surgery without having to have someone else's blood.
Thank you, Pat. We now go to Sylvie. Good morning, Sylvie. Oh.
Morning.
Good morning, Sylvie.
Good morning. Good morning.
Go ahead.
I want to ask about gum disease and the treatment.
Blood disease? Blood disease, you said?
Gum.
Gum disease, okay.
And the treatment.
Okay. What about gum disease? I'm not a dentist, but gum diseases usually are associated with improper or not improper cleaning techniques. Sometimes you may have another systemic condition that can affect your gums, but generally proper flossing of the teeth, regular cleaning, even getting professional cleaning at least twice a year by a dentist or dental technician does help to prevent gum disease. Certain foods also can contribute to you getting gum disease, but by eating a lot of fruits and vegetables and so on, that helps to clean the teeth regularly.
Let's look at something that came up with one of the previous callers, blood count. What is a regular blood count, and what exactly is that?
Well, in males and females, this is a different accepted level. For a female, we accept 12 or above as normal. In a male, we'll go like 13 to 18 as a normal hemoglobin level. Because when we talk blood count, we're talking about the hemoglobin, the concentration of red blood cells which carry the oxygen through the body. If you don't have enough red blood cells, you become fatigued. You can feel faint a lot. Sometimes if you are anemic because of cancer or a loss of blood due to ulcers or something like that, it can cause your blood count to go down. But of course there are certain conditions like sickle cell anemia, which she said she had that from a child, and I wonder if she may have a sickle cell condition or sickle cell disease can also cause you to become anemic.
All right. Let's say good morning to Christine.
Hi, good morning.
Good morning.
How are you?
We're good. How are you?
Okay, I'm fine.
All right.
Can you tell me the best way to get a baby to eat spinach?
The best way to do it is that you sit down with the baby and you eat spinach and you give the baby a little as you eat. If the family eats, then the baby will say, well, this is something good to eat. But I don't know why you need the baby to eat spinach. The baby should eat a wide range of vegetables. I don't know what age you're talking about either. I guess you're talking about over 1 year old, because you're not going to talk about a baby in your arms. But if you do it, then the baby can do it, and encourage the baby that is something nice to eat. But along with the other things, the carrots and the beans and the and the lettuce and so on, if they feel comfortable with eating it, because they may have a problem with chewing at that age.
All right, Doc, we will continue our segments in just a short while. We're taking a break. We will come back with some more of the Doctor on the Doctor Online. Indeed, like the sergeant says, don't be wrong and strong, because, you know, if you get hit by a car, all that expletives not going to change a whole lot. And it is against the law, I think, in Barbados to be using expletives in public still. So be careful. Let's get back in with our doctor on the line now, Dr. Adrian Lord. Well, I thought we were going to play the theme, Doc, but I guess we will play it shortly. Let's look at some of the things that was in the news recently, or something that was in the news recently. Serena Williams, pulmonary embolism. What's an embolism?
Embolism is transfer or movement of blood or air from one area of the body to the other one. She had a clot which moved from her legs. She travels a lot as a sports person across the Atlantic and so on. And although she's an athlete, the clot seemed to move from her deep veins, where she had deep vein thrombosis, and went to her lungs and caused her some problems. It can be a serious thing. You need to thin that blood and prevent it from causing damage to the lungs, because it could lead to death. Is that potentially serious? Yeah,
that's one of the things that you were wondering. If, first of all, as an athlete, is this normal, or is this just a freak thing?
No, it can happen to anyone. An athlete would less likely have it because that person is active, but if you go on a 12-hour flight across the Atlantic and you're sitting in first class, she would be, or it probably is worse yet if you're sitting in economy. But, and then the stasis, the lack of movement of the blood for that period of time can cause clotting, and she's not small either, so that can also contribute to it.
All right. We have Marcia on the line. Good morning, Marcia.
Good morning, sir.
Good morning.
I'm calling to ask a question. I have thyroid. I recently went to my gynecologist. He told me I was slightly anemic. He didn't say how slight. I'm taking Vitaplex M at the present moment, but I had a period 3 times last month. Each time I had it, I was like tired, weary. My head was dizzy a lot. But I cannot use certain things, as my doctor said. So I don't eat a lot of different sort of fruits, because I can't use apples, them sort of things. I can't use spinach with the thyroid. I don't know how true, but that's what he said.
Yeah, but if the doctor says that, I guess you have a thyroid condition where iodine deficiency is part of the problem, and therefore he would restrict you from using certain vegetables and certain foods because of the condition that you have. But having 3 periods in 1 month does predispose you to anemia, and therefore you would need to build back up that with your iron tablets that you mentioned that you're on. There are other things that your gynecologist could do to try to regulate the periods, if he can find a direct cause, or whether the thyroid is acting and causing your periods to be irregular. By treating the thyroid, that may have to sort out the gynecological problem.
And we say good morning to Julene.
Hi, good morning.
Hi, good morning.